Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning and welcome to Ethical Perspectives on the News. I'm the Reverend Tom Capo, Minister of People's Church Unitarian Universalist, and I'm your moderator for this morning's show. Well, we're going to talk today about civil rights in the corridor, and in particular, what it can be done to improve the rights of marginalized groups here in the Iowa City, Cedar Rapids area. A month or so ago, I attended a program called the Second Annual Diversity Focus Forum. Some of the program focused on research done by Diversity Focus here in Cedar Rapids on marginalized groups. And as I listened to all the research, my takeaway from that was that marginalized groups still feel marginalized here in the corridor. So whether we're talking about gay, lesbian, bisexual, transgender community, the African American community, the Latino, Latina community, or women in the corridor, there has been some change, but generally speaking, these groups still feel oppressed, disrespected, or unable to get the same opportunities or rights that white males in the corridor are still getting. So I wonder, is this an accurate picture of what's really going on in the corridor? Is there more information that we need to really understand what the civil rights situation is here in Cedar Rapids and Iowa City? And what can we do? What can we do about achieving more equity in the corridor? To help us with this discussion today, we have a wonderful panel to my left here. To my immediate left is John Paul Chazon Cardenas, is that correct?
That is right.
Oh, I did it, okay.
Thank you.
Who's the director of the Cedar Rapids Civil Rights Commission. And then to his left is Sarah Riley, who's an attorney at the Tom Riley Law Firm.
Yep.
Thank you for being here. And then on the end there is Anthony Brown, who is the manager of Community Engagement and Development for Diversity Focus. Thank you all for being here.
Thank you for having us.
Well, let's get started. So, what is the state of civil rights here in Cedar Rapids and Iowa City area? From your perspective, from each of your perspective. I know each of you has kind of a different way of looking at this, so who'd like to go first?
You'd like to think that you have an open and welcoming community. Obviously, no community is entirely open or entirely welcoming. I don't think Cedar Rapids or Iowa City or Eastern Iowa is necessarily worse than other areas, but the idea that we don't have room for improvement would be fooling ourselves if we thought we were the perfect community.
I would agree. There's a lot of work to be done. I'm coming from a different community recently. About 2 months ago, I moved back to Iowa. And we moved back to Iowa because it is a great place to raise a family. My wife and I are both new Iowans. Our family is here. We're all new Iowans. And so there's some wonderful things about Iowa. But within that kind of welcoming of a community in Iowa, there's also those areas and those gaps where people are left out, either intentionally or not intentionally. And we see that specifically in the data. If we look at the indicators of well-being, whether it be health, whether it be the juvenile justice system, housing, economic development, business, we see those gaps when we talk about communities that are left out, usually communities of color, women, and people who are LGBT or people who have disabilities also. So.
We deal with the cultural competency aspect of the community and the sub-communities within the greater whole. And we do see within our focus areas of economic development, employment, education, arts and culture, and health and well-being that there are disparities in the system that we have created. And Diversity Focus was created 8 years ago to kind of address that issue specifically around workforce retention. And not just with people in their jobs of, how we may spend 8 hours a day, and I'm knocking on wood on that one, because some of us do spend more time at work, that people spend 8 hours a day at work traditionally, but then they have 16 hours to build a life. And if they can't find anything to do that is of interest to them, or they can't find people that are of interest to them, or like them, or share their commonalities, then they don't want to be here. And if they also don't live in neighborhoods, or they go shopping and don't feel treated equally, or their kids are treated differently, they don't want to be here. So we're working with other groups to kind of increase that sense of community and awareness and inclusion.
And part of that is how they feel treated by police, by not only other groups, but the law enforcement. Certainly we've seen situations where a person of color, for instance, might be pulled over just because they're a person of color. It's rare, but it does happen on occasion.
Well, Diversity Focus recently did our 2013 Creative Corridor climate survey. And I believe, and I don't have the numbers in front of me, but 80 to 85% of the African Americans that responded have felt discrimination in one aspect of our indicators. So we looked at retail, we looked at police, we looked at employment, we looked at schools, we looked at access to health care and how health care providers would treat them. 85% of the African American respondents said that retail, that they experienced some form of discrimination. 47, there was in the 40s and 50s for police, for retail. So if an African American person went into a store, they were treated differently because it was automatically thought of that, oh no, this person's going to steal something, and so we have to treat them differently.
So profiling in one form or fashion.
Yep. And there are other communities that showed in different aspects. So like LGBT had the highest number of discrimination in healthcare and religious providers in schools, which is different than all the other communities because LGBT is more of it's an acting issue, not an acting, but it's not as, you don't wear it on your skin, if that is a...
Sure.
It's not obvious.
Yeah.
I mean, obviously if you're an African American, unless you're very light-skinned, it's obvious when you see somebody, whereas if you're gay, it's not necessarily obvious, and unless you tell somebody, you wouldn't necessarily know. The healthcare is what I found curious. I'm not surprised when I hear statistics. They used to talk about shopping while black, and there's a big thing with Macy's, and I can't think of the name of the
Barney's?
Barney's, thanks. Barney's in New York, about, profiling there. And so the shopping doesn't surprise me, or maybe a feeling that you're being singled out for arrest. But what surprised me was when you said gay and lesbians with regard to health care. I'm not surprised with religious, because certain religions, as their tenant, would not be welcoming, and therefore you would expect a higher number. But the healthcare kind of surprises me that you would think that they would feel discriminated there. It
was based upon, and feedback that we received was that healthcare providers are not all educated on treating an LGBT patient. So there are issues with trans patients, with supplements, and with hormones. Okay. That, if I was a trans male to female, and how am I supposed to go to my doctor and say, hey, I'm Anthony, but I want to be Paula? Okay. And the doctor is going to get that from left field and not know what to do. And so we're working on programs to help kind of increase the awareness and cultural competency within the healthcare system as well. Mm-hmm. And we've also identified providers in the corridor that are educated on LGBT issues per se.
Okay. I was going to say, John Paul, if I was going to ask you, I know that I'm with you on the Civil Rights Commission, that in a sense you're looking at some of these issues both in terms of research and in terms of bringing in people from the community, leaders in the community, to begin discussions on where are the holes and how do we begin addressing some of those holes?
And it's building on the diversity focus work that they did a while back, getting the stories of the community. A lot of the work that we're doing and how we're setting up our platform, there's a decision that the commission did recently where the floor of our community, the desired behavior by our community is actually civil rights. Sometimes people interpret that as the roof. But we really need to start seeing it as the bottom of the acceptable behavior pyramid. And on top of that, there's things that may not be entrenched in law, but they are about being a good community, right? An example of that would be health disparities, I think you were talking about. An example of would be closing the achievement gap in their schools. An example of that is having staff in our city, in our schools, in our AEAs that represent the kids that are there. An example of that is disproportionality in confinement facilities. And we can go on. So the commission did a strategic decision this year to treat civil rights and investigation as the floor. That's going to continue. It doesn't change. But to also work with the disproportionality in our community. And we started a project. We now have 60 different groups from across our city, our great city, working together to identify the data that says where are the disparities in our community so we can focus on those and have a dialogue around the community around how we can change those indicators in 6 areas: health and well-being, child welfare and safety, which includes public safety, it includes economic development, it includes housing, it includes education, and it also includes the health disparities. So it's in kind of a gamut of all of them together that we're having those dialogues. And that will continue this week, and in February we'll bring it to the rest of the community and get the input from the rest of the community before we release the report in May.
Now, Sarah, you're in the legal field. I hear. I guess you would be exposed to a lot of people who come through the legal system, and your peers as well. Do they see a disparity? I mean, like we're talking about here?
Well, when people call me, it's with a specific complaint, and a lot of people who call are surprised to learn that we're an employment at will state, and they're kind of surprised that they don't have more rights than they do, regardless of whether they're a minority or not. You'd be surprised how many people don't think that their boss can tell them what to do, when of course they can. But no, there's plenty of people who are treated differently because of the color of their skin. I see less of it than I used to see as far as discrimination with the LGBT community. It was much greater before Iowa passed the employment non-discrimination law, because before that, it was funny. The first thing you'd ask them is, where do you work? And then if it was somewhere where you're thinking, okay, is that Hiawatha or Cedar Rapids, you'd have to get the address and figure it out. And it's like, I'm sorry, you work in a place in Hiawatha. You have no rights. Yes, your employer can terminate you because he found out you were gay. And that used to actually happen. And then you'd find out somebody else, oh, you live on, literally the business is just on the Cedar Rapids side. Yes, you do have a right. Your boss can't get mad at you because he found out you were gay and fired you. So, you know, obviously a lot of people who, when they contact me, they already believe they've been discriminated against. But I now see, ever since we've passed that law, which was back, I don't know, 7 years ago, 6 years ago, there's been far less discrimination against, at least that have come to my office. I'm not saying that the environment is perfect and that no one who is gay is discriminated against in employment. I would not be so foolish to think that. But the number of calls I've received has been far less.
And I'll just tag onto that. And I know we're going down the LGBT hole really quick, but trans issues are a lot in the workplace right now. And it's not necessarily just being a lesbian or a gay man or a bisexual person. There are a lot of cultural competency issues with dealing with trans issues now that workplaces are trying to deal with. So it's like access to restrooms and all that other fun stuff. So, and I do want to add on to the civil rights thing of, now this is my personal opinion, it's not necessarily just the right, but it's also being able to build that sense of community, of I see our corridor as being a region of opportunity where if you spend the time and if you know how to, and if you understand the barriers, like there are barriers, no matter who you are, no matter your privilege, there are barriers to success, and it's how you overcome them and the people that you bring onto your team. That no matter your skin color, or your sexual orientation, or your gender expression, you can be whatever you want to be here. And I think the corridor is one of the few areas in the country where you can actually make that happen, and make that happen to a pretty good amount of success.
Let me take that cultural competence issue even a step further, because cultural competence is not something you apply to communities. I think the literature has evolved over the last 20 years in a really wonderful way. It used to be diversity or multicultural education and so forth. Cultural competence actually applies in the literature specifically to professionals. It says, are you able to work with somebody who is culturally different than you are? And that's what makes the difference. It changes the locus of responsibility, rightfully so, from the community member. It used to be the person has to change before they come see a doctor, right? It changes it to the professional in a way that says, you are being paid. You are supposed to serve anybody who's in front of you. And you're supposed to have the skills to be able to do it, whether it be using an interpreter and translator, which is huge in a medical condition, and we're not very good at doing here in Cedar Rapids, whether it be changing your pedagogical methods when you teach children who are of color, and as you probably know, Latino and African American youth are growing by leaps and bounds in our community and bringing in about $7 million a year extra to the school district, whether it be for attorneys being able to rightfully use, legally use interpreters and translators in their field. So all of those things really are in the locus of responsibility of the professionals. And where that gets me to is actually one of the things that I hear over and over in this community is that it's not only the community members, it is the professionals who may or may not have the skills to be able to work with somebody who's culturally different than they are. And an understanding that is their responsibility to make the change, not the community members.
Well, you're actually saying, so if I have a person who speaks Russian, as an attorney, it's my responsibility to find an interpreter so that I could represent that person?
But if you're in the courts, yes.
Well, I
So it is the
understand,
courts,
but
yeah.
the problem, I understand if I was a court-appointed defense attorney, yes, and the court appointed me. I don't do criminal defense work, so that's not where I would be. But if somebody called my office, and we have had people who don't speak very good English when they call, and fortunately, oftentimes they've had family members who are able to interpret, and we've been able to represent them. But the way I interpreted what you're saying is if a professional has the obligation to find an interpreter, and I just think from a cost-benefit analysis, there's no way, whether a doctor can't have on-call, I can understand having somebody who speaks Spanish because there's enough people. But you couldn't have available to you at a moment's notice 20 or 30 different languages. I know they do at the University of Iowa, but that's a much bigger hospital. But to expect a local physician's office to be able to have an interpreter available, I think to a certain extent the person who doesn't speak English, and I probably sound like a right-wing far-right person, but I would think to a certain extent a person who doesn't speak English also has an obligation to find somebody to help them communicate, because otherwise you'd be asking a dentist to incur quite a bit of expense so that they can, talk to somebody.
So if you receive federal dollars, yes, you do have that responsibility.
Well,
as
I
an
don't receive federal
institution.
dollars, and neither does the dentist.
And to also kind of challenge that stance, what you're saying is that it's only up to a professional, those in the business community, to make the change happen. That if you are a person who, you work your 9 to 5, but you are a community member through and through, that you don't even consider yourself professional, to me it's increasing the awareness and the exposure to other cultures and other ways of thought and other types of people,
So
it does have that increased cultural competency, that it's not just the business or the professional aspect,
Parse it
but
out,
is the
because
community
the
aspect.
literature talks about cultural competence in the professional field, right?
It also talks about in the community field as well, because you have to build that
in the community field,
awareness.
it talks about welcoming communities, about building community, and so there is a little bit of a differentiation there. Yeah.
Yes and no, in my opinion, just because to build a welcoming and inclusive community, you have to be culturally aware and culturally inclusive and culturally competent to know what your own strengths and weaknesses are. Like, I can say that I am a quarter Hispanic and 3/4 German, but I am a white guy.
Maybe let me flip that on its head. Maybe it has to do, when we get to the community, I think I would use a different model, because I think the model really makes a difference here. And I would talk maybe about the privilege that I carry.
We all have privilege, and I would agree with
We can talk
that.
about that. And so that's a different dialogue than when a professional, especially if they have federal or even state dollars, has a responsibility to not discriminate on national origin. Language falls under national origin in our law. That's how it's been litigated. And so
I don't know a case law that says, I mean, I'm sorry, I do not know of any case law that's, and first of all, federal dollars or state dollars, an attorney who's representing someone, unless they are court appointed, isn't taking federal or state dollars. So the attorney doesn't apply. Most dentists I know don't take federal or state dollars. Some do, but actually it's kind of hard to find a dentist who will take dental, Title 19. So actually most actually don't. But the idea that a professional has to go out and pay to have an interpreter so that somebody can come into them, if you're saying if they're taking federal dollars, then you're saying, so the federal prosecutor or the federal public defender's office needs to have that available, and the federal courts do have those. I don't think they have all array of languages, but I think at the same time there is an obligation on the person who comes into our community who does not speak English. And I haven't had any problems. I've had many clients who do not speak English, and I've had no problems because almost every single one of them has had either a friend or a relative who has come with them, and they've interpreted. Now, I assume they know what they're saying, but...
And they don't. I mean, I used to work in school districts all the time in different parts of the United States. I used to actually, one of the school districts that I had was the most diverse zip code in the United States, which is Tequila, Washington, right? And one of the things that was, they used to do many years ago, and I've seen in other school districts too, here in Iowa, is use family members, the janitor, as interpreters. That has a dual effect. One is it minimizes a marketable skill of people, and then it may lead to mistakes. It's like using, not using a stethoscope when you're trying to listen to the heart of a patient. How do you make a diagnosis if you don't understand what a person is saying? And so it really has also a very strong practice environment in it. Let me give you an example. I know of cases, and these are cases that are actually out there, where a child was asked to interpret for a parent around communicable diseases. What does that do in effect for the child and the parent? Is that actually causing harm in the family system? And so we need to
Probably
also
would depend
have
upon what the answer was. But I mean, seriously.
Well, let me ask this question in a slightly different way, because you're talking about language right now.
Yeah.
What about disability? I mean, we've certainly gone through a huge change in our culture in the past 20 or 30 years in accommodating for people who have disabilities. Is that any different than what we're talking about here?
Well, yeah, it's major difference. Our office has a ramp. Our office is up to code with disabilities. We have people in our office all the time who are in a wheelchair and disabled. Our bathroom is a large size. I've had many clients, like I said, who do not speak English, and I developed a good relationship with them. I've trusted the people that they have had. If we had had to go into court, I would get an official interpreter, but their children, and when I say their children, they've been adult children, or their spouse, or their neighbor from the community has interpreted. If I was required, which I'm not by law, and if you say you need federal state funds, I don't take federal state funds, but if I was required by law to have an interpreter, then my client would have to pay for that interpreter. So from that standpoint, I don't think my client would want to, on a bill, receive the cost of an interpreter, because I would have to, pass that bill on to them. And so that, from that standpoint, I wouldn't.
Can I make an easy, just kind of funny comment? There is actually an app for that, that you can download it and you can call, and they have like 370 different languages that they'll have a licensed interpreter pick up, and you can have that conversation right there. And that is something, technology is, it's both a bane and a blessing because it increases awareness of bad things, but it also increases access to good things.
Right.
And let me put another thing. Now we have something like 15% of the population in the United States is not Latino, actually almost 17% of the population. That means quite a bit of money is invested by the community. Now, a question in Iowa, which has changed almost 100% in the Latino population, speaking a second language, for example, as I do, speaking Spanish, as an attorney makes you more marketable. My sister's an attorney for Principal Financial. One of the reasons they love her at Principal Financial is because she speaks English and Spanish. She's able to, that's what I would call cultural competence, right? That's a practice issue. And to be able to do that makes her simply more marketable today. So that's a value.
Right, but what you said wasn't just Spanish. You're saying, and then later you changed it to, well, if you're taking federal or state dollars, which most dentists and lawyers wouldn't, most doctors would because they would take Title 19 patients. But if you were saying just if somebody who speaks Spanish comes in, you said any language. And so I use the example of Russian. Because I happen to know somebody who speaks. I've had clients from Bosnia. And fortunately, they've had more than enough people who were able to interpret, but you had indicated that it was the professional's obligation
From a practice stance, yes.
to find it. And from a legal standpoint, that actually isn't true. Now, it may be if they take federal or state dollars, but it's not. And I mean, I'm sure I'm coming across as somebody who is not very liberal, and trust me, I am considered a bleeding heart liberal, but when I'm told that I have an obligation to find an interpreter, and when I know legally I don't, I'm certainly not going to have the viewers think that that's actually a legal obligation when it certainly
But there is
not.
but there is a piece here that I think John Paul brought up, but I think is interesting. We have both the legal and the economic benefit.
And the practice.
And the practice. And one of the things I know in talking with people at Diversity Focus, for instance, has been that if people are aware that there is some economic benefit to them to be more open, to support the civil rights of others, to to learn a different language or to have an interpreter, that there is a benefit to that. So we have different areas where people may find that diversity actually improves the quality of the work environment or makes people more creative, or there are lots of things like that. Your question is the legal obligation to do that.
My question wasn't so much as a statement that there is not a legal obligation. I'm certainly not saying that people shouldn't be bilingual. I think that the earlier you teach a second language in school, the better, because kids are like sponges and they pick it up and that's a positive. And I do know attorneys who speak Spanish, although most will say if they don't speak it enough, they don't speak it well. And that is certainly not something I would not recommend for people to know more than one language. And if you had a community where there were a lot of people who speak German and not English, it would be important to learn that, and it would be a smart business thing. But saying it's a legal requirement when it most certainly isn't.
Well, it sounds like we could go on
for hospitals.
I know, but you didn't say hospitals.
As much as we
I
could continue going on with this
agree,
conversation,
hospitals.
I'm afraid that we're out of time.
Okay.
But I want to thank you all for a very spirited conversation, and I want to thank all of you for watching today. Ethical Perspectives on the News is supported by the Interreligious Council of Linn County. Take care, everyone.